staff, the nurses, the volunteers. It seems more of a calling than a job. You walk in and you feel it.
I call it now our saving grace. It actually has empowered us to feel normal and typical.
You enjoy the water, huh? You go swimming? You wear a bathing suit? Oh, okay, good. Come on, Bob.
No way!
You kiss me.
We are able to offer really very sophisticated medical services in a spot that feels really so much more like somebody's home than a hospital.
Doing palliative medicine means that you get to help a child every single day to feel better.
Oh, okay. Temperature is hot. Now back up.
I'm 17 and I go to California for the blind. They're always welcome here at George Mosque, and they will clap their hands for me, clap their hands and sing and shout and dancing and hopping around the house and
Respite care is a gift to our families who have children with really complex medical conditions. We can say, bring your child to us and we will take care of him or her, and you can go home and crawl back into bed and catch up on your sleep. You and your husband could go to San Francisco and spend the night.
When KAITLYN first started coming here, I had not left her in years because she was so complicated. She doesn't eat and she needs seizure medication. So there's something to do every 2 hours. I was really nervous, but coming in here, their training it's amazing. And they love KAITLYN. They ask her things that have nothing to do with her line or seizures or tubes or formula. They treat her like a whole person.
It feels comfortable here. Everyone around here is like family. I'm so grateful for that.
In the hospital, I was working in the pediatric intensive care unit. There just wasn't as much time to spend with children. Here, because there's only 8 patients total, we really get to know our patients and our families on a whole different level.
Their whole system is based on what's best for these kids and their families.
Our families don't see a bill. That's part of our mission statement, is to provide this type of care for anybody who needs it. As the acuity level increases, we offer more complex care.
Little prick.
Children post-surgery, where the family needs to learn a new protocol, new equipment, a new dietary plan. The family can come stay with us for that training from the nurses. So before they get home, they feel confident, okay, we've got this. And then, of course, the most poignant, it's an honor and a privilege to provide end-of-life care for children.
I don't know. I don't even know how to express it. I've had to deal with letting go.
Yeah. And
it's hard.
It is.
We all know this is the hardest thing your family's ever had to deal with. But you don't have to do it by yourselves.
Jonah lived exactly 40 days. Sometime between when we were in labor and delivery and when he was born, he had a birth injury where he didn't get enough blood and oxygen to his brain.
5 months now after his loss, and it's just still in it. Some days you're fine, and some days you're not.
We were really relieved that a place like George Mark existed. Leaving the NICU and just the craziness that surrounds that was very cathartic. And Jonah had his own room that I don't think he ever saw because he was just constantly being held and loved on. I just remember having this sense of like,
I wish I could just sprinkle pixie dust for everything to go away, but we can't. So then what we can do though is love them, be there for them, make them happy.
Look at you.
I didn't miss it, so I didn't see it.
It's not a woe is me experience here at all. They see every beautiful part of every kid who comes here. To let go of that pressure and to really get a break, it's helping me on every level. I got married, I have a baby now, I let more into my life. Trusting people is a beautiful thing.